In 1970, a Japanese biochemist by the name of Satoshi Omura discovered a bacterium that had intriguing effects against roundworm. He shared his discovery with his American colleague William Campbell, who worked for Merck Pharmaceuticals. Campbell used the bacterium to create a medicine called ivermectin, which was released by Merck in 1980. Ivermectin was found to be extremely effective against a disease called onchocerciasis, which is better known as river blindness. River blindness is caused by a parasitic worm, and it has caused untold suffering and even death in parts of Central and South America and much of Africa. With the use of ivermectin, river blindness has been largely eliminated in the Americas and greatly reduced in Africa. Billions of doses of the drug have been administered, and it's listed as one of the World Health Organization's essential medicines. Merck's patent on ivermectin expired in 1996. The drug is extremely cheap to produce, and it's available all over the world in a variety of formulations. Best of all, it's extremely safe. At normal dosages, it has no important side effects. In 2015, in recognition of his contributions, Dr. Omura was given the Nobel Prize for Medicine, which he shared with Dr. Campbell. Fast forward to early 2020, when the COVID pandemic was spreading around the world. Scientists and doctors were searching frantically for drugs that could treat the disease. The obvious place to start was with existing drugs that had shown antiviral activity. Early in the year, a team of scientists working at Australia's Monash University did a literature search and discovered that ivermectin had shown activity against such viruses as Zika, West Nile, and influenza. They performed a series of experiments in which they found that ivermectin displays remarkable activity against SARS-CoV-2 in vitro, which is to say, in test tubes. They published their results in a paper that appeared in April of 2020. They found that a single treatment with ivermectin produces a 5,000-fold reduction in viral levels without any cytotoxicity, meaning it didn't harm the cells. Along with their results, they proposed a mechanism whereby ivermectin achieves this miraculous effect. Around the same time, a pair of scientists working in the United States realized that ivermectin was being widely used as a prophylaxis against river blindness in Africa. They wondered if the use of ivermectin would have any effect on rates of COVID-19. They looked at countries where ivermectin was administered to entire populations and compared their rates of COVID-19 to countries where they had no such program. They found that countries that had widespread ivermectin prophylaxis had significantly lower rates of COVID-19. Meanwhile, doctors in hospitals around the world were dealing with an onslaught of patients with COVID-19, and they had no good medicines to treat the disease. One such doctor was Jean-Jacques Reiter, a critical care and pulmonary specialist working at Broward Health Medical Center, the largest hospital in Miami-Dade County. Being a lung specialist working in the ICU, Dr. Reiter was truly on the front lines of the war against COVID. One day, he found himself talking to the son of an elderly woman who was doing very poorly in her fight against COVID in the ICU. Keep in mind that this was at a time in the pandemic when those who were dying of COVID were not even allowed to visit with their loved ones before they passed. They often had to say their final words via telephone. Let's let Dr. Reiter tell the story from here.
I called the patient's son up and said, listen, you may want to call mom. Mom is deteriorating rapidly. She's likely going to end up on a ventilator, so talk to her now. So we went back and forth. It's like, doctor, there is something else. There must be something else. I'm like, no, sir, I have nothing. Nobody has anything.
But luckily for this patient, this man was not going to give up so easily. And he pushed Dr. Reiter to think of a treatment.
I tell him, listen, there is this one study that I reviewed 2 days ago in test tubes, in vitro, about the use of ivermectin. He goes like, okay, so let's do it. Okay, so she got ivermectin. Within 48 hours, her FiO2 requirements were coming down again, and probably within a week or so, she was discharged to home.
Dr. Reiter went on to treat a series of COVID patients with ivermectin, and he published the results in a preprint paper which appeared in June of 2020. Later in 2020, he testified before a Senate committee about his experiences treating COVID patients with ivermectin.
Of the hundreds of outpatients treated by my team, only 2, I repeat 2, were admitted to the hospital. Neither one of them died. Neither one of them needed intubation.
At the same time, all around the world, a number of unintended controlled studies on the use of ivermectin to prevent COVID-19 were being carried out. One such study took place at the Valley View Care Home in North York, Ontario, Canada. A daughter of one of the residents of the care home reported her experience on the YouTube channel of Dr. Jennifer Hibbard. Her mother lived on the 4th floor of the care home, which experienced a scabies outbreak in March of 2020. The residents of that floor were treated with ivermectin, which eliminates scabies. Residents of other floors were given smaller doses of ivermectin to prevent scabies. The staff of the care home were not given ivermectin, and many of them tested positive for COVID-19 when the pandemic swept Ontario in the spring. Despite the staff coming into constant contact with the residents, here's what happened.
On the 4th floor, which is the floor that had the scabies outbreak and they received the highest dose, had the most infected staff, and not one single resident was infected with COVID.
As anecdotal reports and studies like these started to pile up, they caught the attention of doctors working on the front lines against COVID. One such doctor was Pierre Corey, a pulmonologist and ICU specialist working at New York's prestigious Mount Sinai Beth Israel Hospital. New York suffered one of the worst outbreaks of COVID in the entire world, so a pulmonologist working in the ICU of a hospital in that city probably had a closer view of COVID-19 than almost any other doctor on earth. In the spring of 2020, Dr. Corey teamed up with Dr. Reiter and Dr. Paul Marik to form the Frontline COVID-19 Critical Care Alliance, or FLCCC. In October of 2020, the FLCCC released the iMask Plus protocol, a protocol which centers on the use of ivermectin for preventing and treating COVID-19. In early November of 2020, the FLCCC released a paper in which they reviewed the studies on the use of ivermectin as a prophylaxis and treatment for COVID-19. This paper was a meta-analysis. A meta-analysis is a study which looks at many other studies and analyzes their results. They found that ivermectin was extremely effective in both preventing and treating COVID-19. Here are the findings of 9 studies on the use of ivermectin as a prophylaxis against COVID-19. In this figure, anything to the left of 1 indicates that ivermectin is more effective than the control. Here's a figure from the FLCCC showing the effect of the introduction of ivermectin on daily death rates in various states in the country of Peru. As you can see, the introduction of ivermectin resulted in an immediate and sustained decrease in COVID-19 mortality. Likewise, here's a figure showing COVID-19 case rates in the various states of Mexico. The southern state of Chiapas was the only Mexican state to widely distribute ivermectin. Note the huge reduction in COVID-19 cases and compare it to neighboring states. The paper also discusses a study conducted in Argentina where a large group of healthcare workers was given ivermectin. Of the 788 workers who were given ivermectin, none of them contracted COVID, whereas over 50% of the controls who weren't given ivermectin did contract COVID. The FLCCC paper also looked at 12 studies of the use of ivermectin to treat people who had been infected with SARS-CoV-2. All 12 studies, including 7 randomized control studies, showed that ivermectin was superior to the control. On December 8th of 2020, members of the FLCCC appeared before a Senate subcommittee on the early treatment of COVID-19, which was chaired by Senator Ron Johnson. Here's some of Dr. Corey's testimony to the committee.
Mountains of data have emerged from many centers and countries around the world showing the miraculous effectiveness of ivermectin. it basically obliterates transmission of this virus. If you take it, you will not get sick. I cannot keep caring for patients when I know that they could have been saved with earlier treatment, and that drug that will treat them and prevent the hospitalization is ivermectin. All I ask is for the NIH to review our data that we've compiled of all of the emerging data. We have almost 30 studies. Everyone is reliably and reproducibly positive, showing the dramatic impacts of ivermectin.
Now, given all the deaths and economic destruction caused by COVID-19, you would think that the government and the health agencies and the media of the United States would have welcomed this news with open arms. But that's not what happened. Instead, a coalition of powerful forces acted together to completely suppress any information on the effectiveness of ivermectin in treating and preventing COVID-19. So now, let's take a close look at who suppressed ivermectin.